You're welcome back to the Pulse on the Joy News channel on Multi TV. Now, the Youth Employment Agency has joined forces with the Ghana Health Service and the 1 Million Community Health Workers campaign to bring healthcare delivery closer to the doorstep of every Ghanaian. This is being rolled out to fast-track Ghana's strides towards achieving universal health coverage and meeting the increasing data demands under the Sustainable Development Goals (SDGs). The e-health technical assistants, 500 of them, have been already deployed to districts across the country, will help Ghana meet the increasing demand on health data with the introduction of community health workers in the pursuit of the universal health coverage in the country. Well, joining us to, before we even begin that, today the Chief Executive Officer of the Youth Employment Agency, Ibu Bicham, spoke a bit more about why this program is important.
On behalf of the entire staff, management, and especially the board of the Youth Employment Agency, I'd like to say thank you very much to 1 million health workers. They have been with us right from the start. They have been an integral part of the planning process and the execution process. And most importantly, they have gone out of their way to source these gifts that will be very instrumental in the execution of this module. This module essentially is a dream come true for me. I come from a rural background. I go to the village pretty often. I know how sometimes medical care is lacking in some of these communities. So the combination of our e-health workers and our community health workers essentially radiating from the CHIPS compound and the health centers into the communities, providing first-line healthcare means a lot to me. We live in the information age. We can provide all the care that we provide, but if we don't gather data that can be used to improve health for everybody, we will be working at nothing. So this means a lot to me, where eventually every community health worker, instead of noting the information on their rounds, will just put it into the mobile phone. It goes into the Ghana Health Service database, and it becomes an invaluable part of our health system. We at the YEA are looking at taking things a step further. We will get this right. We'll get the system working where the community health workers collect the information, e-health technicians transmit that information, and then we will take it a step further, God willing, in 2017. At the YEA, we are looking at providing or sourcing another kind of tablets. This tablet will be connected to a small device where you can take a prick of blood, you put it on that device, the device is connected to the tablet, it can analyze, I think, 30 different things, including malaria. So you don't look at somebody and you tell me whether he has malaria or not. You take empirically, you take the blood and you tell you what is wrong with the person, you transmit it, and then the doctor can offer whatever advice.
Well, let's begin to explore this in some more detail right about now. The Chief Executive of the Youth Employment Agency, Ibu Bicham, joins me in the studio now. Thank you, sir, for joining us today.
Thank you for having me, sir.
Also in the studio with us is there Nathaniel Ibu Nsako. He is with the 1 million Promise. It's the company that's supposed to handle this project, isn't it?
Not necessarily handling, but we are partnering with the YEA and the Ghana Health Service to roll out this program.
Let me begin with the technical person before we talk policy with you, Mr. Bicham. So what is this? Is this supposed to provide permanent jobs for people in this country?
Right, thank you very much. I would like to take this opportunity to greet all your valued viewers today. Yes, it's supposed to, that's the ultimate goal. We want to make sure that at least we extend healthcare to the doorsteps of the people. You know that we live in the age where most people, as soon as you talk about health, they begin to look at the health structure or the edifice, looking at a doctor or a nurse. But the health of the people actually begins from the home. The do's and the don'ts, the things that they do, what they eat, and the actions and the inactions of the people. And there is the urgent need to make sure that we bring people into the household level to begin to engage these people at the household level, to teach them or virtually share with them information as to the things they can do to prevent preventable diseases and to stay healthy and live longer.
Okay, so your plan here is to help with the community health assistance in educating people so they don't even get sick in the first place.
That's right.
So they go to the hospitals.
But
we know this was something that was in the offing for quite a while. A lot of people were actually trained for this. What happened? Where did the gap start?
Yeah, the gap started, you know, we've had CHIPS around for the past almost 12 years now. And when the analysis was done, the evidence was very clear that there were people as part of the CHIPS structure. They're supposed to be what we call the volunteers. And you know that, I mean, before somebody can volunteer the time, he or she must be able to put food on the table and have excess time to spare before he can do this. So globally, the thinking is that we need to make sure that we strengthen all arms of the health structure if we indeed want to achieve SDG Goal 3, which is making sure that we achieve universal health coverage. And so, yes, indeed, we have trained community health officers, but these community health officers are managing over 5,000 people when you look at the electoral zones, because now the CHIP structure is like that. We have divided the whole thing into electoral zones. And so this community health officer, two at most of which are deployed in these electoral zones, are taking care of over 5,000 people. The original structure was for them to actually do outreach program, going from house to house and engaging the people like I indicated. But because of the population structure, people get up in the morning because they want to catch the attention of this health officer. They start queuing at the CHIPS compounds and then receiving the care. So by the time she's finished with about 100 person, it's already night, and he's not able to do the actual work for which reason he or she was trained. And therefore, there was the urgent need to create a way by which we can fill that particular gap. And that gave birth to this community health worker campaign, which is a global campaign. And Ghana decided to situate ours on the primary healthcare strategy of CHIPS in the country. Okay, so the target here is to recruit how many of these assistants? We have over 20,000 community health workers, courtesy the YEA and His Excellency's benevolence and key interest in making sure that we achieve this noble objective. And so 20,000 community health workers have been trained and deployed, and 1,000 e-health assistants have also been recruited. We'll come to the bit about the e-health technical assistance in just a moment. But Mr. Beecham, in terms of policy, do we have the funds required to have this beautiful idea sustained? Because ideas are good, piloting is fine, but can we hold this for a long time, considering what funding is in things like this?
Yes, we do. The Youth Employment Agency is...
if you could just speak up a bit.
Yes, we do. The Youth Employment Agency was born out of an Act of Parliament, Act 887. And when you look within the Act 887, it defines our sources of funding. Number one source of funding is the mobile telecommunications tax. 80% of that tax comes to the Youth Employment Agency. 10% of the District Assembly's Common Fund comes to us. 5% of GET Fund comes to us as well. So the law has assured us a constant stream of income. And like I said the last time I was here, anytime you make a phone call, anytime I make a phone call, 80% of that tax comes straight into our accounts to help employ and sustain all our initiatives.
Okay, now the community health assistants in the past, and as I mentioned earlier, they have been trained to be integrated into the health facilities, be it CHIPS compounds, be it clinics, be it hospitals. So is YEA now footing that bill for these people? Is that what it is?
Yes, we are. We are footing the bill. We are paying all the beneficiaries. We call them beneficiaries. We are paying all the allowances. We are paying all the allowances for the e-health technical assistance.
Why don't you let the hospitals take up this bill? Why do you have to take it up?
Our mandate mandates us to pay our beneficiaries those allowances whilst they are in under our program. Okay,
so this program runs for how long?
It runs for 2 years. At the end of the 2 years, there's an exit strategy which we, in conjunction with 1 million, discuss with the Ghana Health Service. As much as possible, they will be absorbed into the mainstream Ghana Health Service. You heard my brother mention some figures. 2 community health officers to every 6,000. Essentially, it works out at 1 community health officer to 3,000. Okay, we imagine, of course, what it means is that there's space for more community health assistants to be absorbed. These 2 community health officers can serve those 6,000. So there's more room to absorb all our beneficiaries for the foreseeable future.
Okay, and the reason I raise this point is this. Yes, you say that they will be absorbed, but if you look at the numbers and the hospitals and the clinics and the health facilities, not all of them can be absorbed after the 2 years, can they?
All of them can be absorbed. You see, don't focus on the hospitals and the polyclinics. Focus on the CHIPS compounds.
Okay.
There are almost 7,000 CHIPS compounds scattered across the country, and the number is constantly increasing. And when you look at the population per CHIPS compound, there's always room for more human resource. The more human resources you throw at a community, the better the healthcare.
And so when these people are absorbed, they will be taking regular pay. Yes. And I ask this question because often when these modules come up, the criticism that comes up is that, fine idea, it can work, it will help people, but is this a job someone can keep for as long as possible?
Yes, it is a job that someone can keep as long as... You see, we've built in a career path. You start out as a community health worker. You receive constant refresher courses. It is our mandate to provide that training. At the end of it all, there's a certificate. After the 2 years, when you get absorbed into the Ghana Health Service, you can also take advantage of their certification and essentially build a career to become a nurse and possibly a doctor if you are focused enough.
That looks like an alternate route into that area, isn't it?
It is a route into that area.
Alternate route.
Route.
You know, I mean, just add a little to what he just said. Yes, you know, we have suffered as a country where people refuse postings to hard-to-reach communities in the country. And so this is a way by which these kids or these people are actually recruited from within the communities where they live. And so whetting their appetite for the health profession is one of the main objectives. Making sure that the indigents within the catchment areas or the hard-to-reach areas are also encouraged, motivated. And I mean, you whet their appetite for the health profession. We've had that experience before, where when we piloted this particular concept for 10 years in the country.
Piloting for 10 years?
We have piloted this for 10 years in this country. And over that period, we have had midwives, professional midwives, out of that cadre. We started them off with community health volunteers.
From what period to what period?
From 2000 to, we just ended it 2015.
You said it was 10 years?
Yes, what I mean is that we have piloted it over a 10-year period.
Okay.
And we have transitioned into another phase of SDG. What I'm referring to now is the MDGs. We started it with the MDG, piloted it over a 10-year period, and then we are rolling it, the experiences that we've gathered over the years, into this new concept, or the concept that we are developing, or the model we are developing with the YEA.
Okay. Now, the e-health assistance you speak about, how does that work? What's the plan with this one?
Okay, thank you very much. So the whole idea is that now we have deployed what we call the community health workers into the communities. What we've realized is that they do a lot of work. And this also means a lot of data coming through, because one thing is that they are supposed to register every member of the constituency where they are going to operate. So we're going to have a very clear data base coming through. We are also going to register every person according to the disease pattern and whatever it is that is the ailment. And all these things are more or less a lot of information that is going to be collected. How do we transmit that information into the mainstream? Because they are meeting over 6,000 people and they are gathering all these data. There's the need in this global technological advancement age to try to make things quite real time and faster. And so the idea is to equip these community health workers with mobile phones, with a software that will allow for them to register to people and just enter the data quickly.
Is it up and running?
It's up and running.
What kind of data, and when you said you should pick this information with your phone, is there a central database where all the information gets into?
Yes, there is a central database. I mean, we have, for the Ghana Health Service, they have what we call the DIMS2, which collects data, is an aggregated data from the health facilities.
Okay.
And they have an extension of that of e-tracker, the e-tracker system, which collects data also from the CHIPS compound level. And we are extending to collect information from the household level this time around. And therefore, whatever information that comes through the mobile phones goes straight into the server at the district level, where the district health information officer is the one who oversees that particular activity, compile all the information that he gets, and then feeds it into the DINS2, which is an aggregated platform.
Okay. Mr. Mitchell, for these phones, are they being provided by the YEA?
No, this is a combination of the collaboration between the Youth Employment Agency and 1 Million Health Workers.
Okay.
These tablets, they're actually tablets, but they have
tablets.
a phone calling ability built into them.
Okay.
Have been kindly donated to the Youth Employment Agency.
Donated?
Yes, sir.
How many of them?
We donated 500 of these.
500
of these.
So let me understand this. For the role you play in this, how do you benefit?
We are a non-profit organization.
Okay.
And just to take you back a little, the community health workers model that is being run by YEA now with the Ghana Health Service is a global model born from the UN that says that we need to bridge the gap between the vulnerable living in the rural poor, and by way of extending healthcare to them, if we really want to achieve universal health coverage in Africa, we need 1 million community health workers to do that. So Ghana decided, we built a roadmap out of that and then situated it on the chips like I indicated.
Yeah.
And YEA and His Excellency were benevolent enough to say that they are buying into this. So ours is to advance the cause of universal health coverage in other African countries, because we work in about 20 different African countries. This is not coming from our pocket. We also do resource mobilization from other agencies and organizations and benevolent individuals who are interested in supporting the cause of, advancing healthcare in, the sub-Saharan Africa.
Okay.
So that's what
That's fine. So, Mr. Beecham, just so we clear it up, so tomorrow we don't hear anything in relation to this. Is this a contract between YEA and the NGO?
It's a collaboration.
Collaboration.
It's a collaboration.
So is there a binding document on this arrangement?
I believe an MOU was signed.
Yes.
A non-binding MOU was signed.
A non-binding?
Yes, correct me if I'm wrong.
Okay,
Yes.
that's fine. So, that's how we had a conversation here about the modules and where you seek to go with this. You had mentioned that over 60,000 people had been...
62,800.
Okay. What's the number now?
We are recruiting 5,000 NVTI. We are in the process of recruiting another 5,000, we call them occupational safety officers. The number was 10,000, but we split it into two. We are focusing on the western region, the Bronga, Hafu, Ashanti. We are doing it in collaboration with the Secondary Takari Chamber of Commerce. There's a bill of parliament coming up, occupational safety health bill.
When is that coming up? Because I know Parliament is...
Parliament will be in the best position to answer that question.
Okay.
But we are preempting the bill by training these occupational safety officers and then attaching them to every factory or workplace as the bill is expected to.
100,000 jobs is what you were given as a target.
Yes, sir.
Can you meet it now, looking at the time you have?
We are pretty confident that we will meet it, sir.
Okay. What do you say to people who've looked at this and the job you're doing and saying, maybe these jobs that are coming up are job for the boys in political times?
Well, what I'll tell the whole of Ghana and all the taxpayers is that at the Youth Employment Agency, we operate a free, transparent process. Everybody who we employ, who we recruit, train, employ, and deploy, registers online on our online database. Once you register online, our district directors will inform them when there's a module coming up. So, for example, the community health workers module, we collaborate with the Ghana Health Service to select them. We don't select. Ours is to recruit. We recruit online. We gather them. The district health director leads the selection process because he is in the best position to determine who a good community health worker is. Likewise with the police, likewise with the fire, likewise. We facilitate, but we don't lead the selection process.
Okay. I know today you launched another program to have people grow grasses.
Youth in Greening Ghana, essentially an initiative to green our landscape, green our green areas, to create the equivalent of a rat park in every district and regional capital, starting with Accra.
Okay, so how will this work?
Essentially, we are going to recruit 2,500 young Ghanaians. We've accepted applications, but for the pilot, we've selected, in conjunction with the Department of Parks and Gardens, 250 energetic young Ghanaians. They will go to the Iburi Horticultural School. They will pick up the theory of horticulture and landscaping. They will intersperse this with field work. So you go up to Iburi for the theory, you come down to Accra to implement what you're learning. You are planting grass, you are shaping grass, you are planting flowers, you are planting trees, you are mowing it, you are watering it. And most of these landscaping or green spaces are going to have automated sprinkler systems. Where that is not feasible, we will have a truck driving along the lengths of the arterial roads, watering these green spaces. Essentially, we want to create a clean and green Accra using our young Ghanaians.
How long is this program supposed to run?
It's going to run until the Act of Parliament is repealed for any reason. It's going to run into the future.
Would you call these jobs?
Yes, sir, they are jobs because they are going to school. They will emerge with a certification. We are starting with Accra. We have 10 regional capitals. We have 216 district capitals. These 250 are going to be the let me call them the forerunners of the reach into the regional capitals. And you see, once you move from Accra to a regional capital or a district capital, we will recruit youth in that district. These 250 will become their supervisors. They will clean and green their environments.
Okay. Thank you so much, gentlemen, for joining us today. Clearly, a lot of work is being done in this regard. Let's just hope that the work being done provides the needed results, so we all benefit in one way or another. But thank you for coming. Kobne Bobichem Jr. is the Chief Executive Officer of the Youth Employment Agency. Also, Nathaniel Ebo Nsako, the organization you've got to remind me all the time is 1 million community health workers campaign.
Yes.
Okay,
And Ghana
thank
started
you.
with 20,000.
20,000.
Yes.
Okay. Thank you, gentlemen, for joining us today. And we'll see how this plays out in the coming days. Healthcare, greenery, all supposed to help in providing jobs. We'll see how it pans out in the coming days. Moving on to other issues today, it's a week, 7 days to go to the elections. And the president, John Mahama, is combining his campaign tour with official duties. He is currently in the central region where he's scheduled to commission the first section of the Kaswa interchange later today. We're learning that will be done later this evening by 5 p.m. thereabouts. The $160 million project budgeted for the interchange also includes the construction of several community senior high schools as well as boreholes for selected communities within the region. According to his official timetable, the president is expected to commission the interchange around 3 p.m. That's like 49 minutes ago, but we're learning that will happen sometime later. As you can imagine, he is on a tour in the region, but we'll get the details for you in just a moment. But even ahead of that commissioning, my colleague Jennifer Ekramo has been to Kaswa, where the flyover will be commissioned, and had a chat with the project consultant and some motorists as well as traders.
So to my left, you can see gridlocked traffic as commuters are struggling to move from Kaswa into the capital city, Accra. But very shortly, that situation is going to change when the first session of the $160 million Kaswa interchange will be open to the public. I'm standing right at the top. As you can see, all is in readiness for the president to come and commission it later today. I'll be speaking to some commuters and pedestrians as well as how they see this interchange will ease the traffic over here and make it easier for them to conduct business and to go about their daily lives.
Oh, nice, nice,
It's really nice. It has really improved the area. Kaswa is now beautiful. This is part of the national cake that the president is distributing. He's distributing the cake well. I'm from Cape Coast, and I must say, my family and I are so impressed with what the president is doing.
Oh, me share the why sister Kaswa party.
I see he's really developed Kaswa well. People who arrive here get confused when they arrive. They can't believe that this is Kaswa. He's made Kaswa Kaswa. President Mahama should continue with the good works.
On swaso. I want to do my papa.
I fine, fine, but
it's fine. The interchange is fine, but Ghana is difficult. Everything is difficult. Life is tough for us right now. I'm really suffering.
It's
okay. It will help the traffic, but what I learned that the heavy trucks are not going to pass stop. That too is one thing that to worry me. Because if the heavy trucks, all of the trucks will use it, then the whole place will be okay. But since the heavy trucks will use the down and then the light duty cars will use the top, maybe someone may be coming from afar who is not aware of this. He may try to pass stop and then we don't know what will happen.
Oh, Kaswa there, this time the Kaswa effect. Abano aya de pa, ose ebon abaso. Ose ebon abaso ni ehwe so to abano mano. Because you say oba Kaswa
Kaswa is really beautiful these days. Kasoa has changed. It has really developed. We have to congratulate the president for what he has done. He has done a really good job here.
So be guys no and so be be fast be form motor ni ade ama traffic na aba form kakra ma yentaba no
I'm standing here with the head consultant for the project, Mr. Tuareg Amadou, and he's also the PRO for the project. We're going to have a little walk and talk about this project and talk about the merits of it and how it will help the community here at Kasoa. In a few hours, the president will be here to commission the first phase of the interchange. Can you please explain to us how this interchange will alleviate the traffic in this area?
Thank you very much. As we are all aware, there's interchange. It was a campaign promised by His Excellency John Dramani Mahama during the 2012 elections, where he came and then said he was going to give the good people of Kasoa an interchange in a secondary school. As I speak, today being his birthday, he is coming to commission the first phase, which is within 270 meters. So when you see right from there, going above, those going to CP, Opekuma, Winneba and beyond, when upon reaching around Pink FM, they have to drive up. So currently all those going towards that section, together with those going to Robom Road and the Mojuasi Road, all go through the double lane as it exists now. So upon reaching there, when they start moving, those who are going to Cape Coast and beyond start moving up, at least it will reduce the traffic on that what is the name side, thereby leaving those who are going onto the Obom Road and then the Bojuasi Road, or coming to take the roundabout and go towards the Nyanyano Road, the space to also use. So currently, when we finish with the entire project, which would inshallah by next year, when we finish with the second phase and the second and the final phase, which has to do with the ground preparation, the roundabout, the U-turns, and then the traffic intersections, pedestrian walkway, among others, that would actually reduce the traffic drastically. When you see that even with a roundabout, though we have not finished, from the new market end, which used to be very heavy when it comes to traffic, has actually gone down, because now the police the traffic light is not there to stop those coming from Accra and beyond, because they now use the roundabout, and that actually too has reduced the traffic a bit. The Nyanyano section, there is a free flow, and then what is the name? Those coming from this side, the reason why we still have traffic on this section is because of the pedestrian. We are doing a traffic set for the pedestrians who will be crossing, and we have actually blocked one side. That is how come we still have heavy traffic on this side. But when we finish and then we open the road through, that is down there, we will have no issue with traffic.
Okay, great. So let's continue our walk. I noticed that there haven't been a lot of signboards yet directing motorists and pedestrians. So when will that also be erected?
When you are climbing and then you are descending from this side, we've put those metals in place for the signage to be put. And then today by 12, they will put all those signs, so that at least those who are going, it will direct those who are going to fly over. They know that, okay, then when you fly over, you have nothing to do with Kasoa. You are just flying across and then going, that's from the Winneba end towards Pink FM, and then you move to Accra. But those who would be using the local traffic, as I said, maybe the person is slapping onto the Nyanyano Road or doing the U-turn and going to the Bojuasi Road, that one is also being prepared. That will be handled under the second phase.
So another major issue here, apart from this interchange, are all the feeder roads. Even when we went to the construction site, we noticed that some of the roads are in very, very poor condition. Is that also part of the plan?
It is part of the Kasoa interchange. Under the local component, we have a 20-kilometer local roads under the Kasoa interchange project. That is, we have the Wallantu CP linking to the Western bypass at Roman. That is part of the Kasoa interchange project. That is about it is about 4.5 kilometers. Then we have the Obom to Amasaman. That is 33 kilometers. It is also part of the Kasoa interchange project. We have the Zongo New Town Kakraba Road, which is part of the Kasoa interchange project. And then we have the Crispo City Opekuma to Kolomba a link road. That forms the 20 kilometer, that gives us the 20 kilometer, local road component. When you take that aside, this is the Kaswa Polyclinic that we know. Under the Kaswa Interchange project, we have a modern polyclinic that is under construction at CP Everlip, just behind the farm milk, depot. Then we have, currently, there is no linkage between the Zongo and Newtown, linking it to Iron City and Galilea. Under this Kaswa Interchange project, there's a 12-meter span bridge across the Okrudu that has given access to those within that enclave to also move into Galilea without necessarily driving onto the main stretch. Then we have the Western Bypass, which also came in handy through the efforts of His Excellency John Dramani Mahama and Honorable Adams, including the Vice President.
You know, the Kwame Nkrumah Circle interchange, it wasn't just an interchange. There's also a station, there's also a statue, there's a water fountain. Do you envisage something similar happening here?
I've spoken with the project manager, Pedro. He tells me we are developing the Kaswa bus terminal as well, which is part of the interchange. There are 3 bus terminals. We have the Obom Junction terminal because we are doing Obom to Amasaman 33-kilometer stretch. We are developing a bus terminal currently. When you go there, you see that the place has been cordoned off. We are going to work on the old market as well. That's also going to be turned into a bus terminal, just like what we have at Achimota. Yes, so it is part of the Kaswa Interchange. The Kaswa Interchange is a package, it's a complete package, because it comes with 4 schools, 12-unit classroom block each, just like what we have with the Millennium Schools. One at Amuzukope, then one at Kumbe Islamic. Then we have a Plako and Domiabra. They are benefiting from the Kaswa Interchange project with these schools, 12-unit classroom block. That has a sick bay, head teacher's office, staff office, a kitchen, toilet facility for both staff and then students. So it's a complete package.
And today is the president's birthday, and I guess you could say, in a way, by opening this first phase, it's like a present to the rest of the nation. But you know, the Kwame Nkrumah Circle has a nickname. They call it Circle Dubai. Yeah. What would be the nickname for this interchange?
Kaswa is, the word Kaswa is a Muslim name, so we will go by, we want Abu Dhabi. This is Kaswa Abu Dhabi. We are standing on Kaswa Abu Dhabi.
Thank you so much, Mr. Twarek Amadou. Well, we're still on the Kaswa interchange right now. Apparently, Kaswa Abu Dhabi. And we'll be back at 3 o'clock, between 3 and 4 o'clock, for the official commissioning of the first phase of the Kaswa interchange. For Joy News, I'm Jennifer Ikwamwa.
Circle Dubai, Kaswa Abu Dhabi.